Welcome to Central Georgia Focus. I'm your host this week, Raymond Tubb. Well, December is HIV/AIDS Awareness Month, and across Central Georgia and the world, we've seen a considerable improvement in the treatments of the virus that causes AIDS, and we've seen a lowering of the death rates. So today, we're going to look at the current number of infections and some of the critical concerns that we still have about the virus here in Central Georgia. Our guest today is Dr. Harold Katner. He's a noted infectious disease researcher and educator who's worked at Mercer Medicine since 1985, more than 4 decades in the area and working in the area of infection diseases. Dr. Katner is an award-winning national figure on the topic of HIV and AIDS prevention. Many recognitions include numerous awards for community service and research as well. We appreciate you joining us today.
Thank you.
Well, first of all, back in 1983, you were on the front lines of what became known as the AIDS epidemic. And talk a little bit about what the virus was like at that time and the impact it has on the body for people that may not know.
Well, honestly, when I first started dealing with this, we didn't know what it was. And so we were watching these people come in with these very unusual infections. We knew something was causing their immune system to drop to levels that would create complications of infections you and I already had, but didn't hurt us because our immune systems are normal. And they would often die, within weeks to months. And then in '83, they discovered the virus, and there was all this hope we'd be able to control it with vaccines and medications. But obviously, that took a long time, and it went until '96 that we got treatment that could allow people to live a normal life.
Yeah, for people that are under the age of 40, it may be kind of hard to understand what the virus was like back in the 1980s and 90s. I know when Magic Johnson was diagnosed back in 1991, I actually remember interviewing you back at that time about that because it's such a, it was one of the first national public figures to come out and say that they had the disease while they were still alive. And I know at the time we were like, oh my gosh, Magic Johnson's going to be dead in a few years because at that time, they still didn't really have the antiviral treatments and that kind of thing. But I remember I went to interview you for kind of a local reaction story on that whole situation. In the hospital that we were outside of at that time, I had to shoot the interview so the hospital wouldn't show up in the background because the virus was so stigmatizing that people didn't want to be associated with it. Hospitals didn't want to be associated with it or treating it in any way. And I know it's something you dealt with a lot.
Yeah, so one of the hospitals I worked at, they wouldn't let me stay in public. I worked at that hospital for about 15 years. In fact, they tried to fire me twice. And but because, again, of the stigma, the fear of if somebody's in a hospital who's got HIV, am I going to end up in that bed and fear of contagion? I mean, obviously, I've been doing this for over 40 years, and people thought you could shake somebody's hand and get it or cough by somebody. So there's a lot of fear of, can I pick this up from somebody just by casual contact? And even to this day, I still get questions related to that. And I say, well, look at me, I'm still alive. I do this every day of my life. So, so the stigma, and again, the horrendous complications that we saw with this infection. I mean, we had, what's this, RFK has that worm in his brain. Well, we'd see those kind of complications go on and kill people. We'd see cancers associated with this, which could be really horrific from the types of ways it would affect people's skin. Or we had pneumonias that sometimes we couldn't treat, sometimes we could, but again, we knew it was going to come back eventually. And all of these complications ended up, scaring the public, obviously, and it was sometimes scared us because we didn't know how to help the patients very early on. Eventually, we learned how to manage a lot of this stuff, but there were times that even if we did, we couldn't fix it, and that was the horrific impact of this disease. One of the major problems has been, it was also the complications. If it didn't kill you, it could cause strokes and other complications that were disabling. And we still get that sometimes because people, because of the stigma, they don't want to take their medications. They say, well, I don't think about it, I feel good, it'll go away, but it doesn't go away.
Yeah. And we're going to talk more about some of the great strides that have been made, even in the last 10 years. But first, let's turn back the clock a little bit and talk about, something that's kind of remained even now. Numbers are way better than they used to be, but the South and the Southeast and Georgia in particular have always had extremely high rates of the disease.
Yeah, and so a lot of that, I think early on, was lack of education. I mean, I remember I was trying to go to every school I could to talk to the children about HIV. I was, for a long time, I was working down in Warner Robins, and every year for about 23 or 4 years, I was speaking to the 8th graders. And they still come up to me, remember that talk, even though, again, they hadn't heard it in 15, 20 years. Because I really wanted them to understand how serious this was. If you don't know the consequences, how can you make a change in your behavior? And so we really needed to show them what this could do. And we were seeing people pick it up as teenage years. So again, that was critical as far as trying to awaken people to this. But it's still the lack of education that I think is behind why some people still are putting themselves at risk for this. The other thing is poverty. I mean, if you don't have access to medical care, to screening, these sorts of things, that also puts you at higher risk for this. So a lot of times what we were seeing was the people that were impoverished. We were seeing people that lacked the education. I mean, Bibb County was a big fight about trying to get sex education in the school system, as well as HIV education. And I don't know what's going on now, but our numbers reflected that, and that just was really scary and disturbing.
Well, there are currently right around, 1.2 million people living with HIV in the United States right now. What is the picture in Central Georgia like right now?
Well, I don't have the exact statistics of how many are alive with HIV. Our district is about 5 or 6 or 7 as far as numbers compared to the rest of the state. I think about 60% of the cases are in Atlanta, and then the rest of them are outside the Atlanta area. At the Hope Center, where I work part-time, we are probably 1,500 patients. I'd have to go back and get the exact numbers for you. And we're still growing. I mean, we're still seeing new patients. Usually we see them, sadly enough, sometimes they'll come in really late because they weren't aware of it. And they weren't aware of their risk factors that put them at risk for this. A lot of times we're screening pregnant women. We're supposed to be screening every pregnant woman at the beginning of pregnancy and in the third trimester as well. And we're picking up a lot of those cases early because they're diagnosed before they start getting sick. They're not aware they have it. But they recommend that we screen just about everybody so we can get a handle on this. If we pick up a case and we can get them on treatment, the virus in their bloodstream goes from roughly 10 billion viruses, producing 10 billion viruses a day, down to 0. And when it goes to 0, that person can't infect anybody else. So it's treatment not just to help someone survive and live a normal life, but it's also treatment to prevent. And that's the critical thing about trying to recognize a case and get them into care.
Of course, initially it was thought of as a gay man's disease. Yeah. It's, but you were talking about when we were discussing where we are, before the show, you were talking about, we continue to see high rates of infection, especially in the black community, which affects this area disproportionately. But you say the number 2 group is African American women. That's
correct. And so, and their rates like 7 times higher than white females. So I think all the stuff we talked about, the poverty issue, the lack of education, but there's also a genetic issue. That has not been looked at a lot, but we know that people of Euro-American, or in fact Indo-European ancestry, have genes that will protect them from getting HIV. If you have 2 copies of this gene, you can't even get the virus. So there may be other genes that protect you from getting HIV. So if you look at a population that has no resistance at all to it, just like when we brought measles to Hawaii, they all died of measles. We brought smallpox to American Indians, they all died of smallpox. These genes maybe have some role in why, we're seeing more cases amongst people of African American origin. And so if they don't have that resistance, then that puts them at higher risk. Again, the percentage of people, even in the white population, is small that has that, but again, there may be other factors, genetic factors that we haven't looked at that may be playing a role as well. So that's part of it, I believe.
Well, we were talking about some of the big strides and treatments that are now underway that have made a huge difference in survivability and the ability to keep people from spreading the virus. We're going to get more into that when Central Georgia Focus returns. Welcome back to Central Georgia Focus. We are talking to Dr. Harold Katner. He's an expert in research on HIV and AIDS and infectious disease, and has participated in more than 500 HIV prevention programs for adolescents between the age of 5th grade all the way up to college level. Among his recognitions, Dr. Katner was named one of Georgia Trend Magazine's top doctors in 2020, 2021, and 2022. And when we went to break, we were talking about some of the great strides that have been made, even in the last 5 to 10 years with the antiviral medications. I know used to, we talked about it a little bit earlier, it was a death sentence. Often people, if they had it, they may be dead in months or at most a year or two. But now with these antiviral medications, you were talking about, you can get the viral level down to 0. As long as they take the medication, they're not cured. That virus is always there, but they can get rid of the virus completely now.
That's right. Well, and just when you say completely, again, it's because what happens when the virus infects you, it inserts its DNA into your DNA. So that I can't get rid of that DNA yet. We're looking at ways to maybe do that one day. But when the medications are on board, it prevents that DNA from expressing itself into proteins and things that can make viruses. So by keeping a level of the medication at a level that's high enough to turn those genes off, that allows that virus, that causes the virus to go to 0. Now, when they stop the medications and the levels of medicine drop, then the DNA switches can go back on again, the genes can be turned on again, and they can make virus again. So you'll see people coming in and they're doing great for years, and all of a sudden they come in with a viral load of 6,000 or 100,000, et cetera. And I'll say, are you taking your medicines? Oh yeah, doc, I'm taking my medicines, but they aren't. And so I have to push them a little bit. I said, did you miss some doses? And then so I can kind of tell what's going on. When that virus begins to express itself again, then their immune system can get weaker. And again, because of the stigma, and people sometimes, every time they take the medicine, it reminds them they have that. When they stop those drugs, then that virus can resume causing damage to their immune system. They take the medications, the virus goes to 0, the immune system often heals for the most part, and they live a normal lifespan. Yeah,
you talked about the, I guess 1996 being sort of a milestone year where they finally came up with some antivirals that work. But back then, that meant, 20 pills a day and all kinds of terrible side effects. It's very different now. Oh,
it is. I mean, I could give you a list of side effects that sometimes people were scared of taking the medications, but they survived. Some of them still have the scars from those old medications. But in I would say roughly about the mid-2000s, we started getting much safer drugs. And as time has gone on, we've gone from 20 pills a day to under 1 pill a day. In fact, we even have shots now. They get 2 shots every 2 months. They developed a shot that can last 6 months, and we're looking at things we have to pair it with something else. So right now, we use it as part of a regimen, but we have to add pills by mouth to complement that. But eventually, we hope to have drugs that they get shot every 3 months or once every 6 months, and that's it, no pills, which the patients love because they don't think about it anymore. Every time they put that pill in their mouth, they remember this. And again, sometimes there's a lot of trauma to what brought this infection on. So all of those memories, all of those things, again, affect people's adherence, and that's the critical thing. They have to take those pills once a day.
But you were saying you see people from newborns that are born with it all the way up to, you've got one patient that's over 80 years old, and you see positive outcomes now.
Oh, she's amazing. She's lived into her 90s. I say I have my 80s club. I have several now that are in their 80s. I have a lot in my 70s and 70s. And if you look at the numbers of people that are surviving with HIV, the numbers in the state, the prevalence is, I forgot the exact number, but anyway, those patients are much older than the new patients coming in. So the new patients are picking it up mostly in their 20s and 30s, but because people are living normal lives now, we're seeing more and more people in their 50s, 60s, and 70s, and 80s, in fact. So those numbers will continue to grow as they survive on these medications. And the medications, again, are so safe now, you can take them for years and years and years without any major side effects. But of course, we monitor for those, and as we get more data from the studies and stuff, then we can adjust those if we have to, based on their age and drug interactions, those sorts of things.
Of course, I guess I guess you could call it a negative with the medication, with the survival rates, with the treatment now. Are you seeing more reckless behavior from people and spreads and increases of other infectious diseases because of that?
Yeah, it's mostly younger people because this thing called PrEP. We're giving people medications to prevent them from getting HIV. Now, at one point, everybody was using, not everybody, most people were using condoms to prevent the transmission. Well, you take PrEP, which means you don't have the virus, but you take this medication to prevent you from getting the virus. You don't need to use the condom, honestly, or at least, I mean, there's still a small risk, but the risk is small. So because of that, we're seeing this epidemic of syphilis. And it's a major epidemic. In fact, because, there are people that are in the closet or in the down low, because mostly the high rates of this in the men who have sex with men community, they bring it home to their wives if they're married, and so, or their girlfriends. And so we're seeing a lot of women getting it even when they're old enough to get pregnant, young enough to get pregnant. And of course, we're seeing that pass to the babies too. So I've been managing several cases of congenital syphilis as a complication of people not using condoms and transmitting not just HIV, but not transmitting HIV, but they're transmitting syphilis. So yeah, that's been a problem.
So safe sex, always good advice.
Yeah, it is, really.
All right, well, we are talking to Dr. Harold Katner as we are in AIDS Awareness Month and just the past World AIDS Day, and we'll have much more. The Central Georgia Focus continues. Welcome back to Central Georgia Focus. We are talking about HIV, the virus that causes AIDS, and the new successes in educating people about prevention and in treatments now. It's estimated that more than 32 million people have died worldwide from AIDS-related illnesses. Many were remembered during World AIDS Day on December 1st. And our guest today is Dr. Harold Katner, a renowned AIDS and HIV expert that has been working in Central Georgia for 40 years, 4 decades, and, on disease treatment and prevention. And we were talking about some of the many treatments and stuff, but when you get into that, you do get into cost. What does insurance pay? I know there are foundations like the Ryan White Foundation that sometimes can help out, but and you were talking too about the fact that the survivability still, though, it's costly, but it's worth the cost.
Sure. So if you look at, a lot of insurance will pay for this because it's much cheaper to treat the infection rather than to treat the complications. But we're talking about $4,000 a month for most of these medications. The good news is we've had the Ryan White grant that was first, I think it was approved back in 1989, roughly, and that supports our Hope Center. So we get funding from the state, we get funding from the federal government, and again, because this is a public health issue, so with that money, we are able to put people into care, and again, reduce the viral loads in these patients, reduce the transmission, and it's been working. I mean, our viral loads, our numbers are now, we're 89, almost 90% viral suppression throughout the state in populations that are most affected by it. So this has really been a great thing to see, which has led to the decrease in numbers of cases throughout the states. Probably since 2015, we've seen this decline. And again, the more people that are prevented from getting it, the numbers are going to peak.
Figure out they're spreading it.
Yeah, so that's really wonderful. So it's really been, so the insurance will pay, we call it something Age Drug Assistance Program, which is the federal government through the Ryan White. The Ryan White clinics throughout the state also help patients, if they get them on insurance through the Obamacare, they will pay the premiums. So that also helps me because a lot of times, I'm good at HIV, but I'm not good at general internal medicine. But if the patients have no insurance, I'm going to have to manage their diabetes and everything of the sort, which I'm not an expert in. But if I can get them on insurance, then I can get a primary care physician to help me, which has been tremendous. So again, the state has also helped, the federal government is helping support that as well. Even some of the drug companies, Gilead and I believe it's Vive and others have given us samples to get people started on therapy. We try to get people started on therapy very quickly until they can get approved by their insurances or ADAP, et cetera. So these samples, which again was truly a gift because before they wouldn't do that, can allow us, and also to bridge people. Sometimes they lose their insurance, or sometimes insurance decides not to pay for their medications. So what are we going to do in the interim? So we don't have these samples available, then we're out of luck. And again, every time you stop that medication, that virus is going to come back because your genes are getting turned back on again. Some of the drugs, it's dangerous because if you get off the medicines for a short time, you can develop resistance to it. The newer ones, not such an issue, but some of the older ones, it was. And if you get resistance, that means I got to go to a different set of medications. Sometimes more than just one pill a day, sometimes 2 or 3 or 4, et cetera. So I have to make sure I can keep them suppressed the whole time.
Of course, with just about any disease, the earlier you catch it, the better, the better outcomes you're going to have, the less complications. Talk about the importance of testing.
Oh, testing is extremely important. I think every physician should offer testing to anybody. I mean, I've had people that were not tested who were pregnant, and the physician said, well, they didn't look at risk. Well, what is a risk? I mean, you just said if you're sexually active, and obviously you're pregnant, you're sexually active. I mean, everyone needs to be evaluated. And again, we're picking up these new cases in pregnant women who are just not symptomatic because it takes years from the time you get the infection to the time you get sick. But by doing that, you not only help that woman live a normal life to raise those children, but you prevent the virus going to their babies. So getting tested is critical because, again, the more cases we find, the more cases we can treat. Once they're treated, again, they can't transmit that virus anymore. So the goal is eventually to eradicate this disease, and they're slowly approaching that. It may take another 20 years, but at least we have hope now. But we just got to get everybody evaluated so we can address their infection.
Well, you got about 30 seconds. Any final thoughts to leave folks with?
No, I just think that it's critical that we keep educating our children, get tested. The impact on pregnant women has been dramatic as far as preventing transmission to babies, and the cost avoidance or cost savings. A lifetime treatment is like $1 million if you think about it. So getting people treated, getting prevention out there to prevent people from getting it is still very critical.
Well, we appreciate you joining us, and glad to have a positive AIDS and HIV story developing now after having many years where it did not look so bright. But we appreciate you joining us as well. Remember, you can always catch this episode or other episodes of Central Georgia Focus on 13 WMAZ+.